My name's Parente. Just chaired the session of New Insights in Medicare Spending and Outcomes. So what really made this session cool was that we had 5 great papers that are all looking at really important changes that are going forward for the Medicare program as it relates to the Affordable Care Act. The first one was just an outstanding abstract that actually got abstract for the best session for Medicare. And it focused on what happened in Massachusetts because of the Affordable Care Act, and whether or not there's a spillover effect where in the surrounding states there was actually a difference in provider utilization, and they found it. It was actually one of the most interesting and intriguing things I've seen yet about spillover effects from the Affordable Care Act, starting from Massachusetts as an illustration. The next paper focused on changes in Medicare expenditures and then using a novel way to focus on just the major clinical conditions that are driving expenditures. It was done by the Center of Bureau and Labor Statistics, and the thing that made that intriguing is that the level of rigor and the new data they were using was really innovative, and they hadn't really gone to that level before, so that was pretty impressive. Another presentation was actually Medicare making use of actual private vendors who are doing health risk assessments to see if those programs work or not. And they found that a few of them did, some of them were underpowered, but it was really the first time that it seems CMS has let in external vendors and let them actually take a look and see if these programs can make a demonstrable difference. And they do, though sometimes there's higher utilization in inpatient than you thought. We had a great presentation on being discharged live from hospice. There was actually a wonderful map showing that there was almost this completely different demographic thing, just like mortality statistics we see all the time with small area variations. And it just raised this question of why are these people being discharged and admitted and discharged back? And there's potentially a quality of care concern that's huge. There could be a fraud concern, and it was like the first time any of us ever saw anything of that nature. So those sessions really were quite exciting.